let's move on to our third panel of the day, which is my mental health is multilingual. So please tweet out your thoughts during this panel with the associated hashtag, my mental health is multilingual, and we will be sharing some hashtags in the chat. Great, so although the mental health of people across the globe has suffered greatly since 2020, there's a reason for cautious optimism. Not only COVID-19 effects on our collective and individual well-being have forced the world to confront mental health challenges like never before, but also many innovative thinkers, interpreters, and youth advocates have stepped up to the challenge. Today, we can leverage smartphones and wearables to create a more representative data pools of our global population and create pilots and programs that take advantage of learning from diverse and multilingual users. However, within the context of addressing mental health as an ecosystem, the needs of interpreters, still considered to be irreplaceable in many vital counseling sessions, should not be neglected. Interpreters are trusted carriers of culturally and ecologically valid information, yet the work they do creates burnout and secondary or vicarious trauma. This is yet another provocative and much needed discussion about the complexity, challenges, and opportunities for critical language access. Our moderator for this panel is Rania Yunus, who is currently the National Project Manager for Immigrant Employment Councils of Canada at IECBC, and has worked with other equity-seeking organizations such as TRIEC and the Canadian Arab Institute. Over the past 10 years, after being involved with various social impact initiatives in nonprofits, social justice, and inclusion, economic empowerment became a focus of Rania's work. When immigrants prosper, we all do. And with that belief, Rania co-founded Welcome Home TO, a grassroots initiative and one of LAC's coalition members that works closely with local community groups to articulate and bring attention with open hearts and minds, support immigrants' potential for a stronger Canada. Next on our panel, we have Abrar Mekmekia. Abrar is the CEO and founder of Abrar Trauma and Mental Health Services / In This Together and later mental health counselor, and is a member of the CCPA with a passion for empowering marginalized youth and women. She was born in Hamilton and raised in Aleppo, Syria. When the Civil War broke out, she remained in Syria to volunteer and work with SOS, UNICEF, and UNHCR to provide children with trauma-informed healthcare. She was also the recipient of the Honorary Woman of Distinction Award in 2021. Next, we have Jasmine Hawande, the Manager of Communications and Operations at the Canadian Arab Institute. She's a proud Arab Canadian born in New York City, raised in Scarborough, Ontario, Toronto. She oversees the communication team to develop knowledge mobilization products and advance CAI's efforts to impact and influence change through the dissemination of narratives, program delivery, policy, and more. She's extensive experience engaging community members through education and decision-making opportunities through her various roles. She's an independent artist where she explores the intersection between art and advocacy. Next, we have Lola Bandana, who has been a member of the board of directors and led associations committees, including the national and international committees on standards. She's led the creation of the national standards of Canada for community interpreting, was an expert contributor to the Canadian National Translation Service Standards, and served on the IMIA Executive Board. In 2007, she won the Language Industry Association National Award for Outstanding Contribution to the Translation Sector. She's published books and articles on interpreting and translation. She's a member of the board of directors, past president of the Canadian Language Industry Association, a member of the Canadian Advisory Committee to ISO TC 37, and a founding member and past president of the OCCI. Finally, we have Ravita Anthony, the project manager of newcomer and diversity initiatives at Kids Help Phone. and a member of the Project Management Institute with an educational background in social sciences. Over the course of her career, she's worked with marginalized populations to develop programs that deliver positive impacts in the health and education sector. After moving to Canada, she began her career at Kids Help Phone, where she brings passion and lived experience to shape initiative and youth-informed initiatives that support the mental health journey of newcomers and other equity-deserving populations across Canada. A key piece of her work involves increasing language access for newcomers to reach out for mental health support in languages that they prefer, which is a project that Kids Help Phone is working on as they provide counseling in English, French, Arabic via interpreters. So thank you and welcome to our panelists, and I will hand it over to Rania to begin our discussion for today.
Thank you, Nicole, and welcome everyone. Even though our panel today weaves in pretty well with everything else that has been going on, it does come with a different twist and an angle to language accessibility. Having had the opportunity to speak with the panelists today, I realized that we're not only falling behind in addressing the ever-rising mental health gaps and needs, but we're also falling even further behind in utilizing and accessing the need for the potential of language and expression to even start understanding and untangling the complexity of the gaps in this ecosystem. And before we kickstart the conversation, in meeting with the panel, we did reflect on a couple of very interesting findings from researchers. So in their research on joy, researcher Matthew Kwan suggested that because language can shape lived experience, cultures have more words to describe the emotions of joy, for example, and in so they may also experience joy more richly. And so imagine how that can apply for the range of emotions and feelings that we experience as humans, including belonging, fear, anger, and so on. And in her most recent book, researcher Brené Brown says, language matters. It's the raw material of the story. It changes how we feel about ourselves and others, and it's a portal to connection. With the same amount of power, language can also be used to strip people of their dignity and humanity. And the work of our panel speakers today resonates a lot with this knowledge or this shared knowledge, and it's evident in who they are and their commitment to what they do. Ladies, it's an absolute honor and pleasure to be with you today and facilitate this conversation. I would like to start with a round of introductions. Your bios have been shared, but I would like to hear more about who you are and how this work means to you from you. And we'll start alphabetically. So Abrar, tell me, what does the title of this panel mean to you, and how does it relate to the work?
First, thank you so much, Jania. I want to start with thanking you for having me today. It's very lovely to be joining and speak with inspiring leaders, my fellow panelists, and absolutely you, Rania. It's an absolute honor. I want to start a little bit to tell you more about myself, and as you said, like why this panel means a lot to me today. So as you may know, my name is Abrar Mashmshia. I'm a mental health counselor and the founder of Abrar Trauma and Mental Health Services. I live currently in Brantford, which is situated upon the traditional territories of the Haudenosaunee and Anishinaabe people. I was born in Hamilton, but grew up in Aleppo, Syria, and I spent majority of my youth time there, and which was a bit lovely till the crisis hit in Syria. I was about just 17 years old, starting my university in psychology and counseling. I started my practice providing counseling and trauma support for children, youth, and women and families during such difficult times. And I worked as psychotherapist with SOS Children Villages for 2 years. And I volunteered with UNICEF, UNHCR on many projects, which was not really easy time to work during, let's say, like crisis, war, and a huge trauma. It was really heavy work. In 2017, I decided to come back to Canada, where I continued my passion to providing counseling and trauma support for newcomers, children, youth, and families. In 2020, I started noticing a huge gap when it comes to mental health services for immigrants and newcomers and other marginalized communities, especially with the increase of COVID impact on their mental on them and their mental well-being. And I knew I had different approach and to bring to the table. Therefore, I established our organization, Aboutvina Trauma and Mental Health Services, which is dedicated to providing affordable, trauma-informed, art-based, and culturally sensitive mental support to diverse newcomer and immigrant population. Our services are carried out through professionals with lived experience who prioritize the creation of safe and comfortable environments. And now our team, almost total of 36 diverse students and professionals with lived experience. And more importantly, our professionals provide their service to their community, speaking their mother tongue, which that's why we're started with, for now, English and Arabic, and some of our services in Urdu, but we're aiming to expand eventually. So this is the essential, that's essentially because we advocate for more culturally sensitive and linguistically relevant mental health services to better understand and support these communities. This is primarily why I am too passionate today for today's conversation, because it aligns greatly with our vision and our work. And I personally resonate a lot with how much language can intersect with your mental health, as I felt it when I first arrived back to Canada. I was really struggling with my mental well-being, and it was really hard for me to find that therapist that could understand that. First, that language piece, the culture, the trauma, and the story. I understand the struggle that associated with finding, a therapist that can understand that experience, because I felt it. And it's not easy for you to express your feeling, your thoughts, the trauma in another language, even if you're fluent. Well, I was not fluent at that time. I was just starting to learn English. But with that being said, it's even if you grew up with a different language, the mother tongue language is different because it's part of who you are and you grew up with it. You learn how to express your sadness, your happiness, your joy in a different language. So that was huge. That what motivated me to be passionate about advocating for more mental health support in a mother language. And also, and that was in our conversation last time, when you start using a new language, you lose part of who you are. It's like you're going into a new journey to shape to learn about the new you, and to learn about who the new you. So it's different. So that's why I'm really excited, and I want to give it back. I don't want to talk any further. Thank you, Rania.
Thank you, Abrar. Yeah, definitely. With a new language comes a building of a new you. Jasmine, how about you?
How can I follow that up? Abrar is such a hero to me, and I'm so excited to be on this panel with you all today. So my name is Jasmine Hawamde. I'm a third generation Palestinian Arab Canadian, which means that my first language is English. However, my mother tongue is Arabic. And so my relationship with my mother tongue is very different because I was raised by my grandparents. I had the privilege of learning the language, but what comes most naturally to me first is going to be English. But I think what is so interesting about my experience in particular is the fact that certain emotions and certain feelings and certain expressions, I think first in Arabic, regardless of the fact that I'm third generation. And so when you think about that relationship with mental health, I think it reigns true with every generation, because there's a certain relatability factor that comes with expressing yourself, pinpointing your mental health, understanding your own mind well in Arabic, in English, in Urdu, in Mandarin, etc. When it comes to my work, I work for the Canadian Arab Institute, if you couldn't tell already. And the Canadian Arab Institute is a national nonpartisan organization. And so I've had the privilege of working on a project in collaboration with the Mental Health Foundation based in Alberta called Text for Amal. And Amal in Arabic means hope. So it was a program, and is a program, that essentially provides daily positive messages to an individual's phone in Arabic, improve the mood of an individual using cognitive behavioral therapy. And so this program proved to be extremely successful, improved the daily lives of so many individuals, because although it's just a text, it proved to be so powerful. And so it started to get me thinking, if a simple message or a text message could improve the daily lives and feelings of individuals across the country, I can't imagine what further services and care would look like in other languages. And I think that speaks to the work of other individuals on this panel as well. So I'm going to end it there.
Beautiful. And Lola, how about you?
Thank you so much, Rania. And again, it's such a pleasure to be here. Language is one of my passions, and well-being, happiness, mental health is the other. So no better panel to participate and share some ideas. So not only mental health is multilingual, mental health is everything. And I am very, very passionate for the mental health and well-being of interpreters specifically, since that's the area that we are discussing. I remember when we created the national standards back in 2007, we discussed at extent, how do we protect interpreters? How do we take in consideration all that stress, anxiety, vicarious trauma that has been raised that they experience, right? And one of the first lines that we have in one of the sections about responsibilities is safety of the interpreter is always first. So that is something, and the safety starts from the mental health area, because there are certain things that when we look at helping professions, doctors, firefighters, nurses, and so on, we don't see the association that happens in interpreting. For example, interpreters have to do their job in the first person. So when interpreting, and I'm not arguing for it to be differently, it has to be done that way because of accuracy and many other research proven techniques, right? So it has to be done in the first person, but sometimes we don't stop to think what the impact that it has on interpreters to transfer all this linguistic information in the first person. So if the individual that requires the services is speaking about I am in pain, or I am being abused, or I, and when we talk about that in first person, the interpreter is fully associated and fully feeling that emotion. And we tend to discount that. So have been very, very passionate about and taking care of themselves, right? For example, in my business for the last many, many years, usually at the annual conference, I bring green smoothies and speakers on well-being, and people have asked, what does green smoothies have to do with interpreting? Or recently, a couple of months ago, I did a water challenge, and people will ask, what water has to do with interpreting? It has to do everything. Your brain without water simply cannot interpret, right? It dies. So I'm very, very passionate about that, and about the working conditions of interpreting, and discussing how can we support that and make sure that interpreters and the other language professionals as well can take better care of themselves. So, and take care of their mental health, not only to do a better job for the people that we need to serve and provide accessibility, but also for themselves, which it is critical that we take care of ourselves before we take care of other people. So that's where I'm coming from, like very, very passionate to support people. That's my life mission, to help people, and no better group than interpreters, which is one of my passion. So that will be my position on that.
That's amazing, and it gives us a whole new level of appreciation for the role they play as well within everything that is offered right out there. Ravina, you're up next.
Thank you so much, Rania, and thank you for inviting me to join this panel. I think this is a really great event, and like Lola mentioned, this is the panel to be a part of, and I'm thrilled to be sharing space with all of you today. A little about myself. My name is Ravina Anthony. My pronouns are she, her, and I've been working with marginalized communities for almost 8 years now. I'm a Pakistani Canadian, and I still identify as a newcomer because I'm less than 5 years into the country. And I really resonate with what Abrar was saying around building a new you. Even though my first language is English and Urdu is my second language, I still had to unlearn and learn so many new things when I came to Canada and navigate that settlement journey. With regards to my work, I've been working as the manager for newcomer initiatives at Kids Help Phone for over 3 years now. And I think it's especially rewarding just because, you know, I'm a newcomer myself. I bring that passion and lived experience to my role, where my day-to-day looks like strategizing different programs based on the evolving needs of newcomers to Canada, which is forever changing. An integral part of my work is also ensuring that we are increasing language access in mental health, which I'm sure we'll all agree is, you know, the main need that we're seeing across the sector. In terms of how this panel is related to my work, I think it's very, very relevant, especially because Kids Help Phone began offering additional language service, where we began offering phone counseling in Arabic via interpreters in 2020. And what began as a pilot is now a full-fledged program where any young person who prefers to reach our phone service in Arabic can call us for free and private support anytime and anywhere in Canada. This program is funded by the IRCC, the Immigration, Refugees and Citizenship Canada. And it's really allowed us to you know, start thinking about and really start advocating for the need for multilingual support in mental health, which is very, very important. I have more to say on that, but I'll pass it back to you for now, Rania. Thank you.
Thank you, Ravina, and thank you, ladies. When we met earlier or last week to discuss the topic of this panel, Jasmine, there was a common theme that is very evident around the table today, and it is the Arabic language and the Arab-speaking population. When we met earlier, again, we highlighted the importance of how that factors into the wider Canadian society, right? And why this example matters and applies to more language communities across Canada. So as a representative of the Canadian Arab Institute, what do other communities need to know about this population that is relevant for our conversation today? And how will that help transfer, scale, or apply the learnings to other languages and groups?
Such a good question. And there's so much to think about, and I don't think I can hit every single thing you can learn from the Arab community in Canada, and the lessons learned from the Arab community in Canada apply to so many other communities, but especially in the context of mental health. And I'm going to add another layer of this pandemic. We've learned so much because we've gone through such long periods of time of isolation. And so it is evident through research that when any community goes through long periods of time of isolation, that's going to come with mental health challenges. And so in the context of the Arab community in Canada, with the highest unemployment rate in the country, with 25% of Arab Canadians being, or Arabs in Canada being refugees, that's also going to come with mental health challenges, because when you're unemployed, the exhaustion that comes with trying to find economic security, the humiliation that comes with trying to find work while you're experiencing this unemployment in a society that's increasingly so expensive. And so all of these layers basically come down to the fact that resources, especially mental health resources in various languages, is necessary to support marginalized groups across Canada and community groups across Canada, period. It's important. Mental health is health. And without your mind, you can't take care of your body. And how difficult is it to try to integrate into Canadian society, try to prosper, try to be civically engaged when the mental health of a community is not being cared for? And what better way to care for a community than through services in their mother language and tongue? Because there's a certain relatability factor, there's a certain comfort that comes from accessing care in your mother language, even if the vast majority of individuals understand and speak English. There's that certain relatability factor that just can't be replaced when accessing care in your mother language and tongue, even for me. And I'm third generation. So, you know, I started to know that my Arabic is better than I give myself credit for when I started to dream in Arabic. And I was like, hey, okay, my mother language really is Arabic. So that's what I think I have to say about it.
I agree, and I think also as we're seeing as a community that is growing very fast in Canada, seeing my parents age as well, and seeing, you know, it's I mean, that's science. It's not relevant only to one community, but the older you grow, the more you regress to your mother tongue, and that becomes in sense of healthcare and all, it becomes also a very big factor, right? Ravina and Abrar, and you know, pick whoever wants to start first, but how or why was there a need for your programs to start offering the service in that specific language in Arabic? And are you planning to, well, Abrar, you spoke about some of your plans to expand into other languages, but you know, what are your thoughts on that, and why did it start with the Arabic language in particular, just to bring some context to our attendees? Abrar, how about you go first?
Okay, thank you, Rania. So yeah, I as you said, I already mentioned that we're planning and aiming to expand, but that would be over the years. However, according to a report published by World Health Organization, WHO, language barrier constitute one of the most important factors constructing the mental health care access for immigrants who lack proficiency in the host country language. And with the recent flow of the Syrian refugee coming from across the world to Canada, and also when we speak about other immigrants who have been here from Middle East, we see that there is a big population of Arabic speakers, and we do acknowledge, and absolutely, like, there is a research evidence base that there is a lack of Arabic-based mental health services enough in Canada. And from my professional experience working in the field since 2018, I have observed how individuals react to healthcare professionals when they speak the same language. And when I used to work as a clinical clinician previously, before I started the organization, I used to see the joy in the youth or the children's eyes when I used to speak the language. Even the parents, they used to feel safe or comfortable, and they did reported that they felt understood when I used to speak the language. So that's where I felt like it's good to start with the Arabic, because I personally speak the Arabic, but it's not just the Arabic that we're aiming to have. So that's where I want to tackle that first. And but yeah, as I said, I want to see diverse immigrant and newcomers culture and languages being spoken and provided across mental health services in Canada, because I don't know, but I think we do lack understanding of how diverse newcomers and immigrant population are, and how multi-languages they are. And additionally, speaking about the needs, according to our recent research at the Insist Together project, where we wanted to study the impact of COVID-19 on marginalized youth across Canada, the theme of lack of cultural sensitivity was highlighted by 58 of our participants, out of 309 participants. They shared how they feel discomfort with the lack of cultural sensitivity within mental health services. And understanding the sensitivity of individuals' culture and language and religion or the ethnicity creates a barrier to accessing quality mental health care. So many of our participants did report that talking to someone with similar ethnic group or some culture or social identity, or experiences growing up that can relate to them better. So with that being said, according to our recent research, absolutely, when we speak about lack of cultural sensitivity, that can be tightened greatly with the language. So that was one of the the evidence that pushed our need to move forward, was starting with Arabic and hopefully other languages.
It's beautiful. And Ravina, how about you?
Wow, I don't know how much I can add to that, but definitely echoing what Jasmine and Abrar already shared around Arabic-speaking population being the fastest growing population in Canada, which is aligned with what we found back in when we got this funding pre-pandemic, 2018, 2019. So I think I would just add that, there's in the nonprofit sector, a lot of things are funding dependent. So as with that, our project when we started off was also funding dependent, where we had to pilot one language to start off with. And when we started doing some soul searching around, what can that one language be? We did a lot of research. We did literature reviews, we did youth focus groups, we talked to community partners. And the one resounding theme that we found was Arabic is the language that needs to be offered currently. And backed by research, we found, in addition to the stats from the 2016 census, we found that there is a larger youth population within this segment of Arabic-speaking population in Canada. We also found that perhaps this is particular to the refugee population, as Jasmine mentioned, people coming in from the Middle East, Syria and surrounding countries had lesser proficiency levels in English and French as compared to other immigrant populations, which amplified the need as well. Yeah, that's something that we saw across service providers too. And of course, shifting focus to the second part of your question around scaling up. Absolutely, that's yeah, I think that's the dream for Kids Help Phone and really the gold standard in terms of increasing access to as many languages as we can. And this is something that we're actively seeking funding for, and have already started planning through continuous feedback and the evaluations that we've done in the past to map out what does that journey look like in the future.
Awesome, thank you, Ravina. And Lola, the comment that just popped up in the chat is very timely to the question that I have for you. The need and the impact of the programs on the lives of clients or beneficiaries is very evident from what we just heard from Jasmine, Abrar, and Ravina. But there's another side to this experience, and that is the interpreter or the counselor in some instances. What is working at that end and what is not? How are interpreters' mental health being affected, and what's going on that side?
Yeah, absolutely. Thank you for that. And I saw the message, and definitely appropriate for what we are discussing and what I mentioned before about the association that the interpreter has to that emotion, and that whatever is going on is the doctor. And I remember having years ago, an interpreter that went to an assignment, and the doctor was giving the news to the mother that there was nothing else to be done to the child, right? And the interpreter called and says, don't ever send me to a pediatric encounter again. I don't want to do that, because that interpreter felt like he was the one giving the news, right? Like the one not being able to do anything for that kid. And one of to start, from the basics is to identify the situation, identify the emotion, because sometimes we just identify it as burnout and we minimize the problem instead of really understanding what is going on. And we need to differentiate between burnout and compassion fatigue. Compassion fatigue has PTSD symptoms from vicarious trauma, and for the trauma that interpreters go when they are interpreting in situations such as, the very common ones as domestic violence and, and healthcare situations and legal, and that affects their own life, their work. And they not only have that emotion and that feeling during the assignment, but they carry that into their private lives. And when they go home and they interact with their kids and with their husbands and wives, whatever it is, they are already bringing that trauma into those relationships, into their private lives. So the first step is identifying those differences, and identifying that compassion fatigue is a condition that needs to be treated, needs to be identified, and there are things that can be done to resolve those issues. I cannot see the audience here, but I can see the chat. Can I ask, people that are here right now, how many of you have feel anxiety and stress? If you can just put a yes or a me, like I should be seeing a lot of those, right? Like, or, raise your hand. So a lot of us, when we feel, and all of us should be answering for that question, a yes or me, we all have, felt anxiety at times and stress at times. And we do is, a lot of us, what we do is, again, we minimize, we hide that anxiety because we feel that we need to, to do so many other things, and we become functional, right, in what we have to do. So, but in reality, we are making the things worse. And you have interpreters that sometimes they say, oh, I've been doing this for 20 years. I can absolutely handle it. However, the body have not given you the tips that you really have to take care of yourself. And that's one of the things that, interpreters need to think a little bit more, like identify, get grounded, and figure it out. What is my level of empathy? When do I need to say no to this situation? Right? Because that's one of probably worst enemies that we have, is not being able to set limits, to say no, to be able to take a break. If you're in interpreting and have like 3-4 different assignments in between, instead of continuing one after the other, take 5 minutes to get grounded, right? And that's super, super important to identify, yes, what I have is compassion fatigue. My empathy is so high that I am at a higher risk. So identifying really, really helps. And the other thing that have worked very well, and this could be better, again, is having debrief and counseling. Because the interpreting code of ethics do not allow the interpreters to disclose information that is discussed during assignments, so they feel that they cannot share anything and keep it inside. However, there are ways that you can share anonymously how that experience affected you. And especially if the interpreter had personal experiences that are related to what is happening in that assignment. Even more important, there are some organizations in Toronto, for example, the Hospital for Sick Children, together with Access Alliance, they have done for multiple years debrief sessions for interpreters, so they can actually take advantage of that. And what I invite interpreters is take advantage. And I have heard sometimes says, no, like I get so tired at the end of the day, I don't want to go to the, to these sessions. And those sessions are so, so important, because it's taking care of yourself first and making sure that you deal with the situation, that you don't take that home, that you don't take that with you, to the point where research shares with us that there are some interpreters that have dreams about whatever they are dealing with, right? Or that they are constantly thinking about that assignment that they did a month ago, and it's coming up again and again and again, right? So that is not just regular burnout, regular stress that we experience every day. That actually went over the line, and it's having PTSD symptoms, and it is an issue with mental health. But again, there are programs out there. Search for the program, search for what is going on, and see, talk to someone in, a colleague interpreter or someone in the family, without disclosing, of course, the information, and, basically take care of the self. That will be one of the good things that have been happening. And the other point that is not as good in terms of interpreters, and that happens to many other people as well, because of the good that we do in the work that we do, then there is a self-justification. Because I did so much great work today, I am entitled to have a pizza with a Coke at the end of the day, right? Or I'm entitled to watch, whatever 5 shows on Netflix on the weekend, instead of really taking care of the self. So that is another thing, very, very important, like the mindset to, keep the growth. And basically make sure that you don't allow those things to impact your personal life and your work life.
I think what you just said, Lola, requires a whole different panel and conversation. In my world, at least, when it comes to employment and the future of workforce innovation and everything else, it's a conversation starter to how we need to kind of relook and redefine some jobs and how they work and how you can build self-care within them. Do you give them different types of assignment? Is the job itself looking a little bit different to be able to help you and encourage you to integrate that self-care component naturally into it, right? Ravina, I'd like to, you have a lot of counselors at your end from the helpline that you have. How are you finding that experience? I'm sure you'll relate to what a lot Lola said, but what does it look like at your end?
Yeah, absolutely. I was sitting on the edge of my seat while Lola was speaking because it's so relatable in terms of our counseling staff as well. Where even when we began the search for interpreter agencies, one of the key recommendations that our counseling staff actually put forward is make sure they have access to mental health support within their own organization, because these are mental health calls. People call in distress. There's a lot of trauma-inducing content, which I know that our counselors have debrief support, have multiple mental health supports to be able to support them through that. But we need to make sure that interpreters are taking care of themselves as well. So it was definitely one of the key components of the request for proposals process that we went through. So I really like that you highlighted that, Lola. In terms of the relationship with counselors and interpreters, I can say that it's been a really rewarding journey. It's been a learning curve for our counselors as well, who at first were very anxious about how do we introduce a third person, especially on the phone. But we've realized that it's working together, and counselors have really appreciated the fact that interpreters can offer not just the language support, but also cultural support. For example, in many of our conversations, even though we have a separate line for Arabic, so you select 1 for English, 2 for French, and 3 for Arabic, a lot of the times what organically happens is that a caller will slip into English because they speak a bit of English, of course, but it's just having that support and that the interpreter present is a comfort in itself, in case that they're trying to explain a complex issue or look for a word that is very common in Arabic but not in English. So they have that support from the interpreters, and even if they're not using them verbatim. And I think it's especially important in mental health, where callers are calling in distress and they tend to fall back on their mother tongue. In terms of, I think, what's working and what's not, there's a lot, but I think maybe I'll highlight one point for each. So in terms of what's working, I think for Kids Help Phone, we did ourselves a favor by starting small. So we started with a very small pilot that ran over 8 months, but we also took a year to plan that pilot and really build the program from the ground up. So we worked on capacity building of our staff. We worked on identifying reliable interpreter agencies that are professionally trained to provide interpreters that support a national 24/7 service. Also building the program from the ground up from a very youth and community informed perspective was something that was very, very important to Kids Help Phone from day one. In terms of what isn't working, I think maybe it's an area that needs more investment, which is what I think we've heard across the board today. Understanding that it's not just the interpreter related costs, but it's also building staff capacity to support additional language populations, building those trainings to add, the cultural nuances that come with serving each population. So investment in training, but also in translation. And I think what we earlier talked about was translating, but also transcreating, which is language, but also cultural translation, which is very important, especially when you take this out to communicate and market to different populations. So it's a cost investment, definitely, but it's also a time investment that's very important. I'll wrap it up by just acknowledging that, we have been very fortunate to receive the funding that we have from IRCC, and we know that support is growing from the funding interest that we've seen from other funders, whether they're government or private as well. So to say that, this is not a lost cause and people are realizing the need for multilingualism in mental health.
Very true. Thank you, Ravina. Bro, do you have anything to add or something you would like to highlight?
I think Lola and Ravina, they really highlighted great points, and I wanted to thank Lola first, because thank you so much for highlighting the importance of self-care for interpreter, because that's something I absolutely agree with. Because especially I think Ravina added the point I wanted to add. Also, having mental health support for interpreter is really important, and I think we do need to do a better job in regard of that, because they get sometimes exposed, as you said, to really traumatic experiences and stories, and that can be really tough on them. And like, yeah, from a person who does work within the field, it's not easy to be able to build that barrier and know that boundaries and know when to take care and pull yourself back. Whereas the interpretation is great and really important to make the mental health services more accessible. Yet I think we need also to work better towards having more diverse mental health professional within the sector and more representation, because with the expansive terminology that we have in English for psychology, it's not the case for other languages. For example, we in English use traumatic events almost on our daily basis, but that's not the case for Arabic. Whereas in Arabic, we joke a lot about suicide. It's not the same in English. If you say, "Oh my God, I'm going to kill myself," it's funny for Arabic speakers. I think Jasmine is laughing because we don't take it that serious. But if you're saying that in English, it's different. So sometimes how we perceive the mental health or the thought, the feeling, it's different. And we interpret it different from language to another language. So I do believe we need both. We need more accessibility and more interpretation. Also, we need really representation and diverse mental health professional, which we do like a lot for all let's say all immigrant and newcomer populations. Thank you.
Oh, I totally agree with you. And look, I've seen really bad family situations go down because of very things that we perceive as funny in our language because it's so common to say, right? I've seen cases that go to the children's aids and children, like children's services and all, because interpreters that don't understand the cultural context would really frame parents as being like health threatening for their kids, when really they're just transliterating a question, a very common question, right? Or a very common term or word or whatnot. And that also I've seen it take a toll on a lot of interpreters and counselors, because they, as it was said in the chat and as we were talking, they feel like they've completely failed their clients. Right? Like literally they have to sometimes kind of say, stop talking to people because you're making it worse right now. And they feel responsible for it, right? Okay, well, we've talked about this, and now it's time to talk about solutions and how do we move forward, right? Jasmine, from your perspective, where does the work need to start? Policies, service, people, what are your thoughts?
I always like to go to Maslow's hierarchy of needs, as elementary as that may be. I always think about health and safety and care, especially in the context of healthcare. I'm Canadian American, and so I know what it looks like to not have access to publicly funded healthcare. And so I know here in Canada, we're so blessed to have publicly funded healthcare, but is it really publicly funded when so many mental health services are privatized, right? And who told us that the mind is not healthcare and shouldn't be prioritized, right? And so when we think about investing in publicly funded resources, I think cultural sensitivity and language needs to be a huge part of that to ensure that folks can access it equitably. And so that includes mental health services, healthcare services need to be in every language possible, especially, I'm going to speak for the Arab Canadian community, one of the fastest growing immigrant communities in the country, with a very high unemployment rate, and folks, that comes with so much complexity, especially when it comes to mental health. I'll also add the layer of access to, I'm going to speak to my own experience to say that I've had the privilege of having so much access to publicly funded resources in Arabic, which made me feel so connected to my culture, to my language, and to my roots, whether it be at the Toronto Public Library or the TDSB's International Languages Program. And that really, when you know your roots and you know your mother tongue, I swear it really did improve my mental health growing up, making me feel connected to my family. And so, in a nutshell, I would say it's important to prioritize publicly funded resources, whether that be the Toronto Public Library, whether that be healthcare, whether that be mental health, which is a part of healthcare, employment services, and all of those things. We need to consider culturally sensitive access and language. That's it in a nutshell.
Thank you, Jasmine. Lola, your thoughts on the same? I mean, you gave very practical tips for self-care, but where do you think does it start? Does it start there, and how do we start the work?
Yes, and I would like to offer a different perspective on this. Like, I agree with Jasmine, and I agree absolutely and advocate for policies and systemic change. Absolutely, I am in favor of all of that, and providing systems, right, that support, people that with mental health needs. However, I do believe that change comes from within, and that's so important. Personal responsibility for ourselves, because if we just wait until the next programs comes on to take care of ourselves, we are not going anywhere. And I spoke about compassion fatigue. In compassion fatigue studies, there are 6 areas of self-care that we need to think about. And I'd like to mention, each of them briefly. So the first one is the cognitive one. And this is where we talk about mindsets and when we talk about optimism and looking at the good side of things. Yes, we have COVID for 2 years. What have we learned over the last 2 years? How can we grow from a challenging situation, right? So that is something that is in our hands, like our, attitude, the response that we have to situations is in our hands, not in a particular program out there, right? Those programs are vital, important, but are not determinant to our health, right? The second one is the behavioral one. What exactly are we doing? Do we have an activity that we love to do that is going to help us? Gardening, cooking, watching a movie, reading a book. What is that we can do to help ourselves to keep that, growing and better mental health? The third one is physical. Actually, I should have mentioned the physical first, because I believe that's the base of the pyramid. Without taking care of our body, we cannot do anything else, right? So drinking water, doing exercise, eating healthy, like the standard North American diet is simply toxic and a killer. Actually regulating our nervous system and accepting what it is, listening to our bodies, listening to what the bodies are telling us and not justifying, I just need to keep going against the current, right? So that is very important, the physical one. The emotional, we talk extensively about the emotional portion, naming that emotion and understanding that all emotions play a role. We do not want to, sadness or depression, they are outcast and we don't even want to experience them. We experience the emotion that we need to experience. And that's it. And how to deal with that is super, super important. So welcome the emotion and then deal with it. The other one is the spiritual one. And this could be, for some people, meditation, prayer. And one of my very favorite ones is gratitude. Gratitude for me is cure for all. And this helps so much if we, look at what we have instead of looking at what we basically a scarcity and what we don't have. Next one is the interpersonal one, and that is relationships. What kind of relationships do we have? Instead of, saying with COVID, we cannot go out, I don't have anyone, I am alone at home. How can we develop those? Like volunteering is one of the best things that we can do for ourselves. And of course, for others. But if we are thinking about self-care, all these little things like taking care of what you're putting in your body, who you are talking to, what kind of peer group do you want to have, what are the people that you want to associate with and that are going to bring you up and give you a better experience. So all these little details that sometimes we minimize and we don't take care of them because there are more important things to do. And it's, I simply go on and eat outside, like Uber Eats, whatever it is, right? And we don't pay attention to what is really important. So take personal responsibility, own that self-care, and start today. That would be for me like the most important thing. And of course, in addition to that, like public funding to programs and additional support that, creates that, extra mental health relief for people. But again, self-care is at the top of my list. Thank you.
Thank you, Lola. Ravina, any thoughts?
Thank you. I think those were really interesting perspectives, and I have to say I absolutely agree with those, but I'd like to differ a bit more, if I may. I think with my work, I've always taken a very grassroots approach. So when I look at this question in terms of where does the work really need to start, I would say research and knowledge mobilization, which go hand in hand, starts with conversations like the one we're having today. Starts with building strong connections with the communities that you're intending to serve, understanding that, not just understanding the needs of the population today, but also knowing that those needs keep evolving and keep changing over time as we see different groups of people, groups of immigrants coming to Canada. And I know Abrar's team has done some great work with the Together Towards Recovery campaign to highlight some of those needs. And Kids Help Phone has also been looking at that very closely. So when we started the Arabic service, we did focus groups with young people. We surveyed community partners to really understand, if we're going to offer this service, how can we make it relevant and how can we make it representative for the population that it's intending to serve? So that's the research part of it. And then the mobilizing would be, gathering that knowledge into reports, publishing that knowledge, sharing that knowledge with, say, funders, government levels, policymakers, whatever have you, to then advocate for that case and highlight the need further. Thank you.
Thank you, Ravina, and thank you all of you for what you. I mean, I guess that's one of the things that Welcome Home to You we've always worked on. We've worked with MCIS on this very closely as well, building those social connections, even to whether to start advocating for further services or advocating for self-care, right? I mean, being able to do self-care here requires that or you get access to information as well. So that in itself requires a lot of grassroots, as Ravina said, a lot of grassroots efforts to kind of build it from the ground up. And we have now about 10 minutes left here. So I want to imagine different futures with you at the moment. And I'd like to see how you would be able to build that ideal future where a world of language access and mental health meet. What would that look like? Abrar, let's start with you.
This is a really great question. I want to start by a quote by Jhumpa Lahiri in her book, In Other Words: to bring relevance to people, you have to be able to speak their language effectively. So with all the appreciation of everything has been done in Canada, I personally think that about what the ideal future would look like, to see various language representations spoken by professionals themselves across mental health services, where it is accessible to all immigrant and newcomers, where they can resonate and feel understood. And absolutely giving the opportunity to choose between choosing the English speaker professional with interpretation, or choosing someone who speaks that mother tongue language and can culturally relate and understand. So that where the ideal future I see for Canada, which I'm personally at the organization, we all trying to work towards. As Lola said, I want to echo on that. The work start within. So when you see the gap, you start taking their part of the responsibility and do what you are able to do. That was the kind of the motivation behind, let's see what we can bring to the table. Let's see if we can really be part of the solution, because it's like so many pieces can be the solution. So one of that could be, ourselves. So I think that's for me the ideal future. Yeah, thank you so much. Rania, on to you.
Thank you. And Lola, I'm going to turn it to you since you were just referenced. What's the ideal future looking like at your end?
Absolutely. I would love to see raise awareness, which we have been working for several years, about the importance of the role of the interpreter, of the professional interpreter, about their needs, and also recognize that vicarious trauma that happened for interpreters, that sometimes we simply ignore it, right? So that's having a system where the interpreter is part of the professional team. We have the healthcare team, and in the healthcare team, they have services, they have counseling, they have debrief for whatever it is that they are doing. However, the interpreter, because it's a freelancer in most cases, is considered an outsider. The interpreter should not be considered an outsider, should be considered part of the team. And as part of that team, have all the benefits. We need to work more on working conditions, so I can definitely see better working conditions for interpreters, which will have an effect in the accessibility for, for the overall population, right? Because the more that we can retain professional interpreters in the profession rather than losing some of them to other areas, the better service we will provide to people who require interpretation. So I raise awareness, a lot of education, and better conditions for interpreters. That's what I see in the future. Thank you so much, Rania.
Amazing. So far we have a future that is very inclusive of so many different cultures, a future that starts from everyone reflecting from within, a future that has interpretation and language accessibility built into teams at many different levels. Ravina, do you have any more to add to this future we're building?
Absolutely. I love what's been mentioned so far. And I think the ideal future aligns really well with Kids Help Phone's mission, which is, people being able to access the support that they need in the way that they need it most, whether that looks like interpretation support, whether that looks like direct counseling. Again, sort of understanding the needs from the populations that we're intending to serve, to then build programs and services according to that. And I can share, I think, being a national bilingual service, we know that it's been a challenge sometimes to even hire bilingual counselors, even though French is a national language. So that's saying something in terms of the level of work that needs to be done to make this ideal future a possibility in the future.
Beautiful. And Jasmine, your future.
Paint
future. You're an artist. Paint.
Yeah, well, folks, I am an artist, so a lot of my work highlights, I think, that my intersectional identity of being an Arab Canadian. And so I think as an artist, naturally, you're a little bit more idealist. I mean, you think about the Canada that we want and the Canada that we're working towards. And the Canada that we're working towards includes everybody in the planning process, puts everybody at the table and coming together when we're thinking about programs, when we're thinking about care, when we're thinking about our policies and programs and educational tools and systems, rather than having it be like an add-on, right? I don't want to build a system, exclude other people from that table, and then, once the system's on, oh wait, I forgot about the Arab Canadians that might need culturally sensitive content. Oh wait, what about the Francophone? Oh wait, what about, no, let's avoid that, and let's build a Canada where we all come together at the table and build together to ensure that we create safe, accessible access to care, education, etc., together. So that's the Canada we want, and that's the Canada that I think we're working towards, because there are great innovators at this table, and I'm feeling so inspired.
Well, thank you, ladies, so much. I mean, you've been so efficient in sharing your thoughts that we're actually left with time. So I'm going to open it to the attendees here and see if anyone would like to add a comment, a question, thoughts, something we might have wanted to mention or you're curious about. I know there was a question earlier that talked about how do intersectional issues such as class, gender, race, sexuality, country of origin, even political differences impact your work with individuals, families, and communities. I think we've covered a lot in it from what we've talked about, but if anyone would like to add to that or ask a different question, please go ahead. I see everyone is getting a lot of fan mail in the comments, so just as a testament to all the amazing things you ladies are doing out there.
I can go ahead and answer that.
Go for it.
I'll attempt.
Go for it. Go for it until we see if anyone else has any thoughts.
I'll say that I think the pandemic has been such a unique and interesting experience, almost like this giant silo where we were able to see how further down the margins certain communities are, and how, depending on the intersections that you live with, you're further marginalized. And that impact has really shown us that, even if it remained true before the pandemic, it furthered individuals in margins during the pandemic. And so I think in the context of women in particular, we're all lovely ladies here, female and proud. I would like to say that, you know, women have really faced the impact of this pandemic. Gender-based violence is a huge issue, and you can't talk about gender-based violence without talking about mental health and the impact of mental health. Unemployment rates for women have skyrocketed because we're thinking about mothers who need to take care of their families, or those who were left unemployed because of the pandemic and haven't been called back from their employer because their employer prioritized the male employees. And so there are so many issues here that we could have a whole nother panel about. However, considering the lived experiences and intersections of individuals when planning solutions and thinking about policy and thinking about, you know, the solutions moving forward is crucial and important. So I don't know if that really answered the question, but I tried.
No, it does. And it just means that we need to have those conversations further and further. And we're going to just start, you know, taking one layer after the other. And that's how you do it, right? Building on what Lola said, we have to start within each one of us. And I think that just on that note, if we all as individuals, as professionals within our fields and whatnot, do that from our side, this is how bit by bit this will all come together, right? Lola, you mentioned that there are services or supports for interpreters. Someone in the Q&A asked if you can please share the names or links of those who provide it. So I'm just noting that, and if you could just put it into, or if you know of any, you could just put it into our chat so people have access to that.
Absolutely, I'll do that. And I'm also seeing a message here from Ruhyun about how the pandemic had ruined interpreter psychological health when we see medical appointments being postponed. And again, that's something that have happened during COVID, that interpreters get that experience, and it goes back to empathy, right? Because you're feeling for that patient who is not able to have that surgery, or who needs to have, like, maybe is a cancer patient and cannot have chemo because hospital is full with COVID patients or whatnot, right? So again, going back to the strategies, what can interpreters do themselves not to have that psychological health ruined? What can you do to detach from that? Because it's something that it's outside of your control. So we need to be very conscious what is within our control and what is outside of our control. So that way, our psychological health is not going to be ruined because of something that we cannot change, right? It's not something that the interpreter has the capacity to make a change, you know, right away. So I'll post, and actually the organization that I mentioned, and I believe, Grace, I think that you are here. She was one of the moderators in a previous panel from Access Alliance. And I just mentioned the panels, I know the debrief, I'm not sure if they are happening at this point in time, but I'll post the name on the chat. And Grace, if you are there, maybe you can share a little bit more information.
Actually, you mentioned also something about sick kids. So I'm just wondering, and maybe you would know that, would all hospitals have that or no?
So some of them, I cannot say right now with
Okay.
COVID, but in the last few years, some hospitals will have sessions for interpreters. I know CAMH at one point had these sessions for interpreters to provide a debrief, you know, that was anonymous debrief about what experiences that they had, you know, during the interpreting, so they don't need to carry that into their personal lives. So definitely hospitals are the best ones at least in Ontario at providing those kind of debrief sessions, and some community centers. I believe Barbara Schleifer has done that as well. I'm not sure if one of the members of Barbara Schleifer is here. And the section that I haven't heard too much is in the legal sector. The legal sector also carries a lot of stress for interpreters, a lot of anxiety, you know, when you are interpreting for a criminal case, right? And I don't think the legal sector has as many tools as the healthcare sector has. And anyways, in both areas, this could be something to be improved. And I'll post some of the names on the chat for people to inquire with them, because I'm not sure if they continue the programs as they had them before, but I'll post the names in the chat.
Thank you. And it is actually Language Advocacy Day. So it is an opportunity for us all to take those services and go to the different spaces that we work in and say, hey, these people have something that support. Do you offer it? And that's how advocacy begins. I thank you all so much for your time, and the panelists, thank you so much for your insight, your stories, and for bringing those important issues forward. And Nicole, I hand it back to you.
Wow, what a great panel on such a relevant topic. So thank you to Rania, Abrar, Jasmine, Lola, and Ravina for sharing your ideas about what the future of our mental health services could look like if we take into consideration the needs of our multicultural populations.